Hello, everyone. Welcome to today's webinar. Thank you all for joining us in this exciting discussion on the evolution from Endimid Pro to the new Pro Max. So today we are very honored to host two highly respected experts in the aesthetic dermatology and energy-based treatments. Here with us, we have Dr. Abhay and Dr. David from India. They're also very good friends of Endimed and have been working closely with us for many years. Both Dr. Abhay and Dr. David have been part of the Endimed journey through webinars, trainings, workshops, lectures around the world, in different countries, and it's always a pleasure to collaborate with them. So thank you, doctors, for joining us today.
Thank you, Indeed.
So during this session, as you know, we will discuss clinical experience, treatment philosophies, and for the first time, we will explore the ProMax. So thank you and have a good time, everyone. So let's begin by, doctors, if you may, each one of you can introduce yourselves, the clinical background, and share the main areas that you focus on in your aesthetic practice.
So myself, Dr. Abhay Talathi, and once again, thank you very much, Endimate, for inviting me and giving me an opportunity to interact with all these global experts. So I am practicing out of Mumbai, India, with my own clinic called Skin Space Clinic, and I've been largely involved over last 16 years into medical cosmetology, procedural cosmetology, dermatology, and aesthetic practice across the entire Mumbai. And I've been largely associated with academics, so I've conducted many workshops and training programs for doctors, dermatologists across India. Personally, with NDMed, we've been working closely and doing a lot of clinical work together, getting better outcomes from the system. And I've been also associated with our IIDWEL, which is the primary body for dermatologists in India, and I've contributed academically there as well. So excited to contribute to this webinar as well.
I'm Dr. David. Thank you, Intimate, for inviting me for this event. Basically, I'm a clinical dermatologist with 22 years of experience in energy-based devices. Started my journey with fraction CO2, and basically I am interested in all those scar remodeling procedures. So I am started with fractional CO2, and now I'm continuing with MNRF and other devices. So I have around 9 devices in my clinic. I am attached to a hospital, government hospital, and a medical college. I'm students for the past approximately 22-25 years. So this is about me. I have a clinic which is called Derma Laser Center, which is located in south of India, Trishul, basically. So, but I've also been practicing for some time. Thank you, Indimat.
Thank you both. So let's start with you, Dr. Abhay. Based on your current practice experience, what are the most common patient concerns you see today? And how do you feel like the patient's expectations have evolved over the years?
So we have more and more patients who are actually focusing on cosmetic and aesthetic part of dermatology. So we are dealing with a lot of acne scars, stretch marks. We are dealing with basically skin tightening, cellulite patients, patients seeking anti-aging through skin resurfacing, wrinkle reduction, for augmentation of certain areas like lips, cheeks, etc. And some amount of basically clinical patients or acne, melasma. So that's our major practice focus. We have a decent hair practice as well, to be honest. Obviously, we're not discussing that today. What I would say is that over last 15 years, there's been increasing demand on the part of patients to help them with these concerns, because initially they were not majorly thought as a large of concern, particularly if you look at stretch marks, open pores, periorbital wrinkling. This was considered quite normal in India. Patients would not upfront come and ask for acne scar treatment when we started back in 2007, 8, 9. But now patients are coming with one demand. Plus, secondly, the expectation is also rising about getting them the best possible results. They are willing to opt for procedures, but they are looking at non-invasive procedures with minimum downtime, and they are looking for optimal outcomes. So they would expect certain specific communication on the part of outcome before they subscribe for a treatment.
Yeah, nicely said. So you mentioned that the patients today are looking for, let's say, easy treatments, no downtime, no pain. So this brings us to the next topic, the non-invasive treatments. So, Dr. David, with the increasing demand of the non-invasive or the combination treatments, how has your overall treatment philosophy evolved over the years?
Initially, when I started my practice, I was very aggressive with my treatment. So I wanted to see an ablation, visible ablation, when I am doing a procedure. So my go-to device was a fractional CO2 laser. So I wanted to see the ablation on the skin surface, then only I am satisfied with the result. Then, when with the advent of, or when I started using MNRF and other non-invasive or non-ablative devices, then I realized that you don't need a visible ablation to get the best results. So now my change in priority is to give the best result without being so very aggressive and producing a lot of PIH and erythema and a downtime for the patient. So that is my change in practice. Now there is I have a layered approach, so I tend to treat areas which patient is bothered about first. So they when they talk about scarring, I tend to treat the scarring first and then go into correcting the texture, the color, and all those um, aspects of okay, when patient coming to you with acne scar, I treat the scarring first, then the texture, color. So that is the layered approach which I get. And then in melasma, when I treat with MNR, that will be the last resort. I would start with the medical management and then shift over to MNRF or Q-Cyst NDI. But it is more conservative. I use very low parameters and to get the best result. If you are too aggressive, you are going to produce more color, more pigmentation, and more PIH. Now, skin laxity, I usually combine multiple modalities, so MNRF and the tightening directly. So these are the changes which has happened. So from aggressive, I have changed over to conservative management mostly.
Yeah.
So as Dr. David said, if you look at what you're looking nowadays is control ablation. So the right targeting of the tissue with the MNRF device is now possible with minimum downtime, and that's been a key to practice, I think.
Mm. Yeah, that's very interesting that now modern aesthetics is no longer about being aggressive or like having a long downtime or doing everything at once. Yeah. So this actually brings us to the next question. As a doctor, how do you decide when to be conservative with the parameters and when to be aggressive, or when to do mono treatment and when to combine between different technologies, different devices?
So, if we look at our approach, then it depends upon what the patient is going to present with. It's more so with that. So, if patient has a sensitive skin, if they are looking for, subtle corrections, if they are already using certain medications which are making their skin sensitive, like someone taking oral isotretinoin, someone who's using topical retinoids or aggressive exfoliants, then suddenly starting microneedling RF with a very aggressive parameter may not be the best for that particular patient. Whereas if patient is looking for little faster outcomes, reasonably has a resistant skin, deep acne scars or deep traumatic scars, patient who are willing to have a little bit of 2 3 days of downtime, which we can expect with aggressive treatment, those are the right candidates to be chosen for the aggressive treatment. Someone who can't come multiple times, then we would probably do combination treatments in the same setting as well. So when you look at conservative versus aggressive, what I also look at is what all parameters. So if you're looking at say Endymed only as a device, then there are three different approaches as we know. One is a 3D heating, which is totally non-ablative. Second is a fractional skin resurfacing, and a third is a intensive, which is microneedling RF. And it's not only about using one particular thing aggressively. So it's not that I'm only using intensive and very aggressively. If I want to be aggressive, I sometimes combine the modalities. So I would do a non-ablative and intensive together, or sometimes we can do FSR and intensive together, so that we can achieve the optimal outcome with most possible what you call comfortable treatment, I would say, for the patient, and get the best possible outcome. So conservative versus aggressive in the whole intimate will depend upon that. And other approaches being aggressive is combining the other devices with Endymion, either on the same time when the treatment is happening for the scars, or second is probably after. So both ways we can practice that, but always be mindful for the patients who have got sensitive skin, patients on retinoids, patient who complain of irritants to topical agents which they are using, patient who have got acne prone skin. So it's like, someone who keeps getting acne after application of one two products, one two acne keep popping. So those are the patients where we would want to be little conservative.
If I
Yeah.
may add, it's basically based on five factors. One is the indication, which all indications you are going to treat. Your traumatic scar, you might want to be more aggressive. Early lesion, you might want to be more aggressive because you get the best result when you just have treated the acne scar or just had the trauma or surgery. And then the skin type. Our skin type, cannot be that aggressive because it is going to pigment. That is second part. Then there is the depth of pathology. So a deep scar or a deep thing, you might be more aggressive and more deep. So that is another factor. The always consider the patient's previous response and how the tolerance of the patient. So these are five factors which should we should consider. That is what Abhay has been talking about. So these are the things we consider before you decide on whether you want to be conservative or you want to be very aggressive.
Yeah. So everything at the end of the day is about patient screening and patient selection. So
Yes.
talking about selection. So Dr. David, you are a physician, but also a clinic owner. So and somehow you're also a businessman. So when you are selecting devices and technologies to your clinic, how do you like what do you take under consideration when you do this today? Because today the budget is limited, but we want to cover all indications. We want to have more and more patients. So where's the balance? What do you do to pick correctly?
It all depends on what sort of patients you are treating. So earlier days, the hair removal laser was a big business in India. So most of the doctors used to buy the hair removal laser first. Then came the pigment laser, so Q610 Diag or a Pico laser. Then the scars. So Scar was the third priority in our practice. Now it is becoming the first priority or the second important, most important therapy. So scar, I started with fraction CO2, then I shifted over to MNRF. I'm using both these days. And then the red touch, 675 nanometer laser, what Dr. Abhay was talking about. Then nowadays we get a lot of patients for tightening. So we have to have some device to do the tightening. So Endymion was one device I was using with all those attachments for the face shaping, the body shaping. Then I added high frequency ultrasound. Nowadays I have added another device which is the microwave tightening along with it. So it all depends on the spectrum of patients you are treating. Now, injectables and biostimulators and Botox, all these things are other spectrum of your therapy. So all these come into play. So first will be like nowadays it is more of pigmentation, then the scars, then hair removal laser, then the tightening. It comes in that order in my practice.
Yeah.
Yes. So as far as the Indian scenario goes, I mean, it will vary from country to country, but most of us are largely doing the energy-based and the injectable practice, which is mentioned on the slide here. And slowly we are shifting to contouring practice as well.
Mhm.
So these are the quite handful of devices which are being used. And when you said about the business aspect of it, because when you invest in the technology, it is very important that you thrive on your business and you do well actually, so that newer and newer technologies can be added. So we follow one simple understanding that what all areas the device is going to add in the therapy part for my patient. So if I have say one device which is addressing 6 to 8 concerns, like if you say a fractional CO2 or an NDAG laser or an NDMAD which has got a multiple therapy platform, then it is obviously going to be much better for a business versus say one single device. Like say if you're doing HIFU, you're only using it for the slimming or contouring, or maybe some cellulites you can treat. But looking at adding technology, that is a very important thing. I would want to basically even advise to young ones who are attending this session that what the technology does after it comes to the clinic, no, is very important. So someone who's using a technology is addressing six, seven, eight different types of concerns to which patients are presenting. That's the first technology we should buy. As Dr. David was saying, that you look at the spectrum of the patient and then decide on the technology. Don't get driven by everyone is using LHR, so let me buy LHR. That may not be the best for your practice. So if you have more patients, say coming for scars, stretch marks, tightening, then you need those kind of devices before you end up buying LHR.
Mhm. Yeah. Thank you for the input. So this brings us naturally to the, let's say, the conclusion that it's not only about adding treatment, but also about creating more versatile systems that can support multiple indications, have multiple, let's say, use. So today, as I said, it's the first time we are presenting the ProMax in our webinars. So I wanted to just a little bit of introduction. So the ProMax represents the next evolution of the EndyMed platform. The system expands treatment flexibility with broader portfolio of microneedling tips, enhanced precision, smarter and faster workflow. And of course, we have the addition of the real-time thermal camera. So Dr. Abhay, as a doctor, among the first doctors in the world to use the ProMax, can you share a real clinical case where transitioning from the Pro to the ProMax significantly improved the treatment and the outcome of your patients or the satisfaction of the patients?
So before, I think we have shared some cases here, but before moving to those, let me tell you, this journey started about 2014, 15, if I remember right, which is 10, 12 years ago,
Yeah.
where we actually had a tabletop Endymet device. If you remember that device, it was not even micro needling that time. It was doing the FSR and the non-ablative skin tightening. And then what I realize now, going back 15 years, that as the practice has evolved, Endymed has evolved with us. So we've been basically adding to the system. Then we moved to Pro, and then now we moved to Pro Max now. Obviously, there are certain features which you look at, and then we'll discuss those in the coming slides. But definitely, it has been a great add-on to the practice because we have been able to achieve some things which is little more efficiently, I would say, much more faster and with much more precision than what we're doing maybe about a year ago. So if you can share some of my patient's picture, I can. Yeah. So this guy actually, we his journey started even before when he had a significant number of acne, and then we got him control on the acne with the medical therapy and maybe 2 3 sessions of carbon laser with Nd:YAG. And then he was majorly worried about the skin texture, tone, and the acne scars. And then for him, we started Endimate Pro Max. We did about 6 sessions of Endemit Pro Max intensive majorly, which were done over a period of 4 to 6 months. And then we have done some sessions of resurfacing laser, which is a fraction 675 nanometer non-ablative fractional laser. So if you can see his number of scars as well as the depth of the scar significantly reduced, the skin texture tone significantly improved. Now the major advantage of Endemit Pro Max here I would like to highlight is that we are able to achieve the hybrid tip. I mean, if there is a slide of hybrid tip, we'll show that later. So a hybrid tip is a tip where there is an insulation on the most of the tip and only the lower part of the tip is non-insulated. So it is giving us a precision in delivering the energy in a deeper scar without disturbing the superficial skin so much, which is a major concern for really dark skin patients because the downtime is reduced, the treatment is faster, the tolerance for the treatment was much better because we could deliver higher energy and precisely in a deeper plane. And because the epidermis was not disturbed, the chance of developing post-inflammatory pigmentation, which is always there for Indian skin type, is also much lesser with, I think, Promax. So that definitely helped this particular patient of mine. And then one more, yeah, this lady is very interesting. Actually, she started with scar treatment and then moved on to a tightening sessions. The results are somewhere in between. She is much better now, even after the tightening sessions. So first we did again 6 sessions of Endimade Intensive Pro Max. I think we added some PRP in this because she was more concerned about the depth of the scar and wanted little quick recovery. Followed that, she's put on the Endimate tightening, which is a 3D technology, and we are using a mini shaper for her. We've done 10 sessions for her, which is over a period of. So we follow a 3 month protocol. Last time I'd shared that with you. So first 4 sessions we do at once a week. Then we do 4 sessions in next 2 months, and then once a month. So it's a 4 month protocol which we do with the tightening. So that is what we've been able to give her. She's much more lifted face and looking younger. In between, we've done other treatments like Botox and all in between. But majorly looking at the Intimate Pro Max, what I feel is better with the newer system is the even when using the mini shaper, we are able to deliver higher energies and in a much less painful way. So it's much more comfortable and easy for the patients even to take the energies like 36, 37 watt, which was not very easy with this earlier devices. That has definitely helped. And the newer camera, I will discuss about it. That has also helped because it can help us to regulate the outcome because we exactly know while doing the treatment what actually happens. So these are two interesting cases. And then there are some other patients which I had shared, which we've been doing an acne scar treatment and another tip, which is basically a zebra tip, which we are using nowadays a lot for stretch marks.
Yeah.
So yeah, this girl again for scar and a pigmentation treatment we've done, and one more patient actually. She came before a wedding, a lot of erythema she had, and now she's got much lesser scars after treatment.
Amazing cases, amazing results. I know that you test the limits of the Pro Max, so we're always waiting
Yes.
for your feedback. Okay, now talking about the protocols, about the sequencing the treatment. So, Dr. David, what's your strategy when sequencing treatments in order to maintain the balance between the safety but also to maximize the efficacy?
Basically, I use MNR for three major indications. One is the scars, that is given, then the laxity, and then the pigmentation. So, looking an active scar, you have to see the type of scars patient is having. So, an MNR of CO2 is best for a rolling scar and a box scar. And you might have to combine it with the subcision, that is for the deeper elevation of this rolling scar, and then a TCA cross for the ice pick scar. So a combination of these are usually done, and then to enhance the result in at least some of the patients, I add PRP. So with the fraction CO2 or MNRF, I add PRP for a better or a faster improvement. And most of the patients will ask for the PIH to remove the PIH too. So the sequencing is mostly like I would suggest that you treat the deepest pathology first. So MNRF will be the best one to correct the deep scars. And for the surface correction, you can use a fraction CO2. Then you can use a TCA cross and subcision to bring it up and remove the ice pick scar. And then you treat the pigmentation at last, because whatever pigmentation you get with the procedures, you can manage with the Q-switch or other devices. That is one part of it. If you are thinking of a traumatic scar, you can always combine MNRF with an ILS or an intralesional steroid to reduce the thickness. That is a combination which I usually use. And nowadays I combine with 675 nanometer laser too. So MNRF with 675 nanometer and ILS. I may not combine it in the same session. I usually do like 675 with ILS or MNRF with ILS, but I do that like alternatingly. That is another part. And laxity, you can actually do the tightening, the radio frequency tightening. But in some areas like under eye area and the eyelid lifting, I find with MNRF gives the best result than doing MNRF. I find alone. So I usually combine both of them. And melasma also I use, but that is a last resort because, as I said earlier, I treat with medical management and see the response, and then treat melasma and other pigmentation with a low or less aggressive parameters with MNRF.
Yeah. Amazing. So now we will show some of the cases to show how efficient and how amazing your strategy is. So if you can tell us a little bit about these cases.
This is a case of acne scar. She had still, while on treatment, she was getting more scars. So she was on isotretinoin, and then I started her on MNR. This patient is basically part of a study, so I did only MNRF, and this was the improvement after like 4 sessions. She had underwent more sessions after that, and I had combined with subcision and TCA cross, but this is only with MNRF because it was a part of the study.
Amazing.
And this is traumatic scar on the forehead, which is treated with MNR. One thing to remember is because of forehead, there is not much tissue underneath. You have to keep the depth of the needle less. You don't shouldn't use like 2.5 and all because it is going to hit the bone and is going to reflect off. So you have to use a lesser depth and a lesser power because if you use very aggressive power, it is going to cause epidermal burns. So you have to use lesser power and lesser depth when you are using forehead over bony areas, etc.
Mm.
And this is a traumatic. It is a burn scar. Basically, she had a LPG gas blast, and then she had a burn over the face and the body, upper trunk. And for her, I had done ILS, the inhalational steroids, and MNRF. So it is not MNRF alone in this patient, but I have combined with a inhalational steroids. So that's a combination which I have used here. The same patient from the side.
Yeah. Yeah,
That
I
is,
remember this case. We even used it in social media. The results are amazing. It's like not only improving the aesthetics, it's also the quality of life. So we have here another one for the body.
yeah, this is stretch marks. This is after just one session.
Mhm.
Only MNRF, and this was the improvement. I don't think I had used a very aggressive parameter. Like for acne scars, I have used 20 to 25 watts, but here I used only 16 watts. But this is just one pass at 3.5 millimeter depth, and that was the improvement which I could get. This is only like single session of MNRF at 16 watts.
If
Very
I may
impressive.
add here now, actually, looking at this patient, basically with the Pro Max, what we have been able to do with the zebra tip, which I was just trying to talk about some time ago, we are able
Mm.
to give a very high energy deeper down, and it is giving at two different levels. If you're going below 3.5 millimeter, so we are doing up to 4.5 mm, and we're able to give higher energy. What we observed is that the if you look at a post pregnancy stretch mark, is a significant laxity of the surrounding skin apart from the actual stretch mark, and that actually helps a lot for achieving that good result with those kind of patients.
Yeah, true.
One found was like when I'm doing 20 to 25 watts acne scar, the pain is intolerable for the patient. So you have to give local anesthesia and verbal anesthesia for the patient to continue with the therapy. What I heard from Dr. Abhay is even with a higher energy, the patient tolerance is much more with the Pro Max. So that'll be a very good improvement in the therapy part of
Mm.
it.
Yeah, we actually heard this feedback from a lot of doctors that now the pain level is less and less with the new tips. And this is actually the goal that we were trying to do with the new portfolio to make the treatments more customized, patient experience even better, not only the doctor. So we will get to the tips and we will have the feedback from each of you about them. But now let's go back a little bit about talking about the combinations. So, Dr. Abhay, I wanted to hear from you. Which are the best or the favorite technologies or modalities that you like to combine with the Promax?
So as I told you some time ago, that when I choose a device, I look at the wholesale offering, which is for my patients, to be honest, because I don't want to be stuck with the device with using only for one, two indications. So honestly, Endymion fulfills that criteria majorly. So if you look at combination, there are two ways of we combine. One is that we combine different technologies within Endymion for our patients, and then other technologies with Endymion. So if you look at the first thing where we combine a lot of patients of I find and the mini shaper for the face. So I find is for brow lifting, little bit of puffy eyes and fine lines around the eyes. And the mini shaper is for the whole face, the double chin, and to some extent, a neck sagging also can be addressed. Then we combine a lot of patients FSR with the 3D RF. So 3D RF, which is mini shaper for the face and the neck, and the crinkling on the neck and fine lines on the neck can be largely addressed with FSR. If patient was a resurfacing, then we can do FSR on one day and then maybe tightening on some other
Mhm.
times. Initially, when we're using a smaller device, as I told you, now I don't do that much, but when we're using a smaller device, we're regularly combining the Endimade 3D followed by FSR for all our acne scar patients because that time we did not have the micro needling in the system. So those who are using a smaller device still can look at that, or maybe nowadays I think MNRF is available everywhere. So understand the depth of penetration varies in these systems. So I find does not penetrate deep because it's for the superficial skin. Then mini shaper goes reasonably deep to cause tightening of the face, and the FSR I think goes around 7 to 9 millimeters in the skin. So an MNRF you have to decide what kind of depth you're looking at. So even if combining different modalities of the Endimade can help to achieve better results, and if you look at combining other devices, then depending upon the patients, if patients are having active acne followed by scars, then we are combining a NDAG laser with Endimade. If patient has majorly requirement of tightening and resurfacing, then we are combining a 675 nanometer non-ablative fractional laser with Endimade. And if patients coming for anti-aging and want some tightening and reduction in the bulk of the face, then we are combining HIFU with Endimate. So that is how we are looking at to combining this. 675 nanometer actually helps us to give a very nice healthy glow. So understand Indian skin is very pigmented. So there is not much honestly the Endimate can do about removing the dark pigment which is there in the skin. It can make the skin surface look smoother, light reflection can get better. But someone who's got a blotchy pigmented spots, we need either Nd:YAG or 675 nanometer. So that is how we combine different modalities.
Yeah. I have a question that we always like doctors are always asking or practitioners. How much like what's the time interval between the different treatments? Like if you are combining lasers with Endimet, like do you wait between the sessions? Do you do it like all at the same session? And where do you start with the laser or with Endimet?
So usually I don't combine both on the same day.
Mm.
Best gap which we try to keep is 2 weeks between the two sessions. Now, depending upon what are we addressing, if your patient is having a pigmentation acne and active acne with some scarring, then I would start with a laser first to address the active acne and the pigmentation, and then we'd address the skin surface and the scar with Endimate. So sequentially, we'll go first the laser and then the Endimate. If patient is coming for pigmented acne scars with not many acne presently, then I would start both together. So I'll start with say NDAC session in the beginning, then the next sessions of Endimate, then again QS NDAC and Endimate. So it's like a serially done one after other. And now when we are combining a 675 nanometer, which is a newer technology actually, not many clinics may have it. But then what we are doing is that we are finishing the MNRF sessions and then we are starting the 675 nanometer. So understand the time frame is very important. Again, it also depends upon how much time patient gives you. Because there may be some patients who come and say that doctor, 3 months I want result. Or someone would come that I'm okay doing a treatment for 6 months. Then someone might be able to come only once a month to the clinic. So those patient related factors obviously are considered. But if they give you a chance, then I would want to do one treatment every 15 days.
Actually, in my place, a lot of people are outside India, so working outside India, and so they come for a very short vacation. So I, most of the times, you have very few days, like 1 week time or 2 weeks time to completely at least do something for them. So what I have combined both like fractional CO2 and MNRF and PRP together in one session. So some patients I have done that. There I have used MNRF first because it is less aggressive, and on top of it I have done fractional CO2 and then applied PRP and put a cling film. So they get that best of all the worlds, and we have least number of sessions. So these are things which has happened in my place, because we get patients who come for 1 week time or few days, like 3 days time. They want to do some therapy and then they want to go, and it all depends on the tolerance of the patient. So before doing such a thing, you have to ask the patient how aggressive you want the treatment to be.
Mhm.
So that is the thing.
Yeah. Setting expectations from the beginning and then tailoring the treatment. Nice. Okay, so now we're going deeper and deeper into the Pro Max. So one of the exciting additions within the Pro Max is the integrated thermal camera. That it's like a temperature monitor, okay, that's built into the device. It's designed to provide additional treatment feedback and maybe confidence during the procedure. So, Dr. David, as someone familiar with the Pro and now evaluating the Pro Max, how do you envision integrating the thermal camera into the clinical decision making? What value do you see the thermal camera is bringing to the treatment?
I was actually excited to see the thermal camera, because whenever I was using Endiment Pro for tightening, the issue was you have to, like, if you are alone, if you are doing it alone, you will be doing the tightening part, and you have to use a IR camera or thermometer to see which all areas you have reached the correct temperature, which areas you have skipped. So that was a big issue, because you have to stop doing the procedure and then do it and then go back doing the procedure. By that time, the temperature would have gone down. So that is which I always felt was causing some decreased efficiency in your treatment. So once I saw the thermal camera, I was really excited, because there will not be any skip areas and you can reach the correct temperature everywhere. So that is one thing which I always felt.
Yeah. Dr. Abhay, as someone who started to use the Pro Max and using the thermal
Yes.
camera, what do you
So
think about it?
I'll share something else. Dr. David is excited. I was not so excited looking at the camera, to be honest, because I thought it's just more of, a kind of addition, just purely commercial addition is what I thought in the beginning, because we were measuring the temperature with infrared. But then what happens when I started actually using? So I'll tell you a story. When we got NDMed Pro Max, I did my own treatment with the RF tightening. And if you remember, I shared my picture also showing instant tightening. And I was monitoring the camera and the sensitivity on the my face, that how much I am able to tolerate. Now the fun of this is that you immediately start noticing how the temperature is rising on the camera. And in my clinic, we have a trained therapist who's doing the tightening treatments, the scar treatments we are doing, which are clinical treatments, but the tightening treatments largely are done by the therapist. Now it is always be grateful for that, and we are very happy to see that the required temperature is achieved. So anytime during the treatment, if I walk in the room, I just see the temperature now, that what temperature is she maintaining. So that's one thing that she is able to see. So what Dr. David was saying is actually true, that you feel more confident after the same tightening session which you've been doing before also with Pro, but you are able to do that. Second is that we have seen that the temperature is rising to 43, 44 degrees on the epidermis, which is even more than the therapeutic temperature which you look at, which is 39 to 42 degrees actually. And patients are able to tolerate it. That speaks a lot for the system. So we feel great with the system that we are able to maintain higher temperatures. And thirdly, when we do with the infrared, the external camera, no, some other person has to do it, or you have to stop doing a session and then check and again start doing a session, and that lag actually reduces the deep temperature, if I understand the science right. So that does not happen with the thermal camera now, because you are just doing and you're sure that this has been achieved. So that, say what we say, the window of 5 to 6 minutes where we have to maintain the temperature on one side to get the optimal result is a assured window now than a thoughtful window. That time we're thinking that it is maintained, now we are sure that we are maintaining. So that assurance speaks a lot for confidence in the physician. So
Actually, I
that
bought
has come in handy. I would take my words back. In the beginning I thought it's not good, but that's come in handy, to be honest.
actually bought a thermal camera for that, because I was asking my staff to hold the camera when I was doing the procedure. Now, if you have something like this, then it is you don't need it. You don't need another person to be helping you when you're doing the procedure.
Then we are even showing picture to some of our patients who are more inquisitive and curious to know what is happening. That also gives them a lot of assurance that no, the treatment is actually doing what it is supposed to do. And in
Mhm.
today's time, no, patients are becoming more and more inquisitive. So that helps in some of the patients.
Yeah. I will share with you my experience with the thermal camera. When we started to do the tests and like to see how is it working, is it really beneficial and adding to the treatment, the my favorite thing was that after the treatment, I was looking at the screen, I'm seeing the homogeneous red area. It was very satisfying and rewarding for me. Like I did it good.
Yeah, exactly.
So it as you said, it's like an addition not only to the practitioner that it's like less work and also gaining more confidence about the treatment and the efficacy, but also for the patient because as I heard a lot of patients now are looking at the screen and like seeing that everything is red, everything is nice, the temperature now is really above the limit that we set. So
Yes.
yeah, this feature that's very, very nice. Okay, so Dr. Abhay, from your daily practice experience with the Promax, which one of the features have like the biggest impact on the clinical workflow?
So if I'm using intensive, then the
Mhm.
treatments are much more faster. So if you use a faster automated mode of delivering the needles, then the treatment time is definitely reduced by around say 3 to 5 minutes per patient. In particular, the scar treatments, which is the face treatment. So that fasterness and obviously the tip modification, which is making it less painful. These two are definite advantages when I'm talking about intensive as a procedure.
Mhm.
So, and secondly, when you're talking about the tightening or 3D heating, then definitely the management of the temperature. And I am not sure what is with the newer system, to be honest, but we are able to give higher energies and the tolerance is significantly better than what it is to be only with the Pro. So these two advantages, which is probably higher energy, which is 100 watt, obviously we have not gone to 100 watt. And mini shaper, I think, gives around 70 watt, which is for the face. So we are able to easily achieve the required temperature and the tolerance is better. And obviously camera, what we spoke about. So these two, three things are a definite look for a new system and adding value to the patients.
Mhm. And what do you think about the new appearance of the device?
That is
Okay.
obviously, so I'm not talking about it. I'm talking only on science here. Yes,
Yeah.
aesthetically it's very appealing, and we have a black system, so that matches with the decor of the clinic as well as the other systems in the clinic. And this tutorial thing I was just reading on the slide, we
Mm-hmm.
could run through those, which because they are pre-recorded in the system.
Yeah.
So a person was wanting to start, like my staff is old, so they were using old system, and we did not have to read through the entire like manual again, but
Mm-hmm.
then learning the system is also become easy with the newer system is I would say for those who are not actually well versed with the system to begin with. So these are definite new add-ons that the interface looks good, the screen is much more bigger than what it was.
Yeah.
And another thing, actually, what we get at the end of the day, we can easily record what was the total energy given to this patient. So when you look at like laser systems, we are more concerned about that, how much is the total energy going. With
Mm-hmm.
MNRF, we're delivering per tip, so we're not looking at that as a parameter. But then
Mm-hmm.
when you look at increasing the total energy, then that also helps, which is mentioned on the system at the bottom, that it is there. And what we've started doing is that we've started playing with the pulse duration. Actually, we are only in the beginning, we are talking about depth of penetration of the micro needling, but it's not only about the depth, it is about how long you're being able to generate the heat at the right level. So when you talk about say a hybrid tip, which is not which is a kind of insulated tip, then at a deeper level you can give a energy for a longer duration. So I'm increasing the pulse duration of the system now, which can actually probably over counter the resistance of the tissue a little better than only the depth of the needle. So the depth does not always, play the role. It is how long and how much energy. These two parameters are also there. And I think managing them with the Promax is a little easier than other systems.
Yeah. This is actually my favorite feature about the Pro Max that like in the energy that the range now the energy is wider, but also the step is smaller, so you can make it more precise, you can customize more.
Yes.
So, Dr. David, from your perspective and like understanding of the technology, what gaps do you feel existed in the Pro that now the Pro Max is helping to address?
When we got the Pro device first, we always used to talk about insulated needle and non-insulated needle. Ours is non-insulated, and you can treat the whole depth in one go. But in practice, what we usually do is for acne scar, I used to keep depth of 2.5 on the cheeks, and then maybe 1.5 another pass I am giving. So it even though you say that you can treat the whole depth with a non-insulated needle in a single go, you are giving two passes. Now it is you have the tip which is non-insulated, or it is okay partially insulated. Then you are more precise at the depth you are going to treat. So you can treat 2.5 millimeter. You can treat 2. You can treat 1.5. It is your choice how to treat. If the device, as I discussed with Dr. Abhay, the device is much faster than the Pro, then the treatment time, another grows with the Pro device was the time taken to treat. So the needle has to come in, it has to go in, then it has to come back. So it takes time for each shot to be completed. Now, if it is much faster, then you can complete the whole therapy in a much shorter time. And the pain part of it, pain is also much less, even with higher wattage. So all these things actually is a big improvement over the Pro device which I'm using now.
Mm-hmm. Yeah, very good. So speaking about the new tips, the new microneedling tips. So, Dr. Abhay, what additional value do you see between the non-insulated along with the semi-insulated, the zebra, and the insulated options?
So as I've already spoken that we have been gladly using these tips now. So Hyper is a non-insulated tip which is there since the beginning. So
Yeah.
Pro is a very good device. Let me tell you, it's not we're talking about Pro Max today, but we have grown up with Pro, and Pro has helped a lot of practice and patience. So this Hyper tip is obviously the same one, if I'm not wrong, which is there with the Pro, and we're able to generate easily up to 2.5, 2.8 mm without any fear. Even in Indian skin, we are able to heat up the tissue. But the zebra and hybrid have a new feature that there's a significant sparing of the epidermis which is happening. So increasing the wattage or increasing the energy which you're going to deliver at a deeper level, say when you're looking at 2.8 to 3 mm zone, if you're using a hybrid tip, then it is something which is definitely adding a lot of value, because the overall collagen shrinkage and the remodeling at the specific point is going to be a little better without any challenge of complications. Zebra tape I'm using largely in the stretch mark patients as of now, where we are looking to go deeper than 3.5 mm, because if you measure the heat or the depth, so you have a zero point 0.5 mm zone which is non-insulated, then 1 mm zone which is insulated, and then again 1 mm which is non-insulated. So you need to be deeper than 2.5 mm to use the full potential of the zebra tip. So when you're looking at somewhere we are going to go deeper than 2.5 mm, then the zebra tip is adding value. So largely I'm using it for the stretch marks for now. And I am looking to be more aggressive with hyperhidrosis treatment also, by going deep to 5 mm and giving the highest possible energy. So honestly, not a lot of patients are seeking hyperhidrosis treatment. The percentage is much lower as compared to, say, a scar patient or a resurfacing patient or even a stretch mark patient. But definitely that's on my card, that maybe in another 6 months we might have a hyperhidrosis data about how the zebra works for hyperhidrosis.
Mhm.
Tip for hyperhidrosis, which gave much very good result. So I had to keep around 3 millimeter, 2.5 to 3 millimeter depth, and 1.5 millimeter. So two passes I had given with that, with the hyper tip. So that is more painful. If you think about zebra, it will be like you can give one pass and then can tackle both depths. So that'll be much easier.
Yeah, yeah, I agree. Okay, so let's now move to the next section. So, Dr. Abhay, what would you what your like top two clinical tips would be for working with RF-based devices or energy-based devices in general?
So one, when we speak about Endymed, the first thing what I would encourage everyone who's using Endymed to do is that explore the combination or synergy of the different RF delivery approaches which Endymed has. So we have a non-ablative approach, we have a semi-ablative or resurfacing approach, and we have a deep heating with micro needling approach. These three are not like, they are actually synergistic. So you can actually do a lot of combination interplay with these systems to get the best outcome. And the second thing is ensure the 3D is used in the best way by keeping the probes at the right place. So the continuous contact of the tightening probe on the face and the repetitive faster motion, actually movement, is going to produce real good results with tightening, because we have faced this challenge that sometimes if the contact is not for a continuous time, and if the movement is not, then the, as Dr. David was saying, the heating is not uniform. So if you ensure that the touch or contact of the device or the handpiece is continuously, and you're using a right kind of movement, the results are going to be very good. So first tip is to combine or use a synergy of different modalities, and second is to get the best out of the 3D which you can, because most of the results of RF technology depend upon how deep in the right area you can heat up the tissue.
Mhm.
Basically, you
Very.
have to match the pathology with the depth and the energy. That is, so what you are treating, you should match with and the energy which you are using. You cannot be, shouldn't be too aggressive. More aggressive doesn't mean that you get a better result. It might cause more damage than what the perceived result. So that
Mhm.
is.
Thank you for this. So, Dr. David, what are some common mistakes you see younger practitioners are making today when they're working with energy-based devices?
That is what I was talking about. You initially I used to be too aggressive, like acne.
Mm-hmm.
My I don't go. I don't decrease the wattage less than 25 watts, and I used to do like that. And secondly, even on the forehead, I used to keep the 2.5 or 2 mm and then do it. So depth was not correct. The wattage was not correct when I started my practice. So that is one thing. So forehead, you have to keep a lesser depth and a lesser energy because you don't want any epidermal burns. And other thing is treating all acne scar with the same protocol. So I was keeping the wattage at 25 and depth or 2.5 and doing treating every acne scar. So depending on the scar depth, depending on what you are seeing there, you have to modify your protocol. And I already mentioned about the aggressive parameters. Then the other thing was I was treating periorbital area aggressively. Again, you have to be less aggressive in these areas. The chance of bleeding, chance of ecchymosis because of the injury which you are creating. So these are things which I had, which mistakes I had made when I was doing MNRF. And the other thing is over bony prominences. So when you are using 2.5, it is going to hit the bone and it is going to reflect off. And the energy delivery occurs and the when it is coming out, or it maybe in the epidermal level. So again, it can cause PIH. One issue I faced with FSR was I was using gel. My thought was when you are doing FSR, you are going to introduce, it is something like a laser assisted drug delivery. I thought if you apply hyaluronic acid, it is going to go into the burnt area and that is going to give good result. I used to apply hyaluronic acid and then I used to do FSR. What I found was all these patients developed PIH
Yeah.
in surface. That is basically because the arcing was happening on the surface between the two, so multiple tips of the FSR, and it was causing a superficial epidermal burn. What I did later was I was doing FSR and then applying the hyaluronic acid. That gave much better result. So these are things which you have to keep in mind when you are doing the procedures.
Yeah.
One more thing is that even though we say No downtime, no downtime. Be aware that in Indian scenario, we give a 2 3 day of guideline to the patient that the grid marks of the intensive or FSR is going to be seen on the face. So a patient who is very busy corporate life or someone who wants to apply makeup immediately on the next day, you need to guide them well. It's not that you don't do a treatment for them. You guide them well that 2 3 days is the time where you need to give to your skin to kind of heal well, and don't play with a lot of post care instructions that don't neglect post care totally.
Yeah.
One other issue I had faced is when I started my practice, I was over promising things. So this acne scar is going to be much this better, that better, and all. So don't over promise when you are doing it. And one issue with just doing MNRF, not combining with FSR, is the surface correction doesn't happen that well with an MNRF device. So for a surface correction, you need something which works on the surface, maybe an FSR or a fraction CO2 to get that surface smoothening effect. Whereas you get the deep effect with an MNRF, which you may not get with an fraction CO2 or even with a FSR. So combining actually helps. I learned in the hard way because I started my practice with the study. So I was doing only MNRF for all the acne scar patients and the same parameters. Then I started combining all these things to get the better results.
Mhm. I totally agree with you. I think that the combination between the intensive and the FSR is one of the best combinations that we can do. Like tackles everything. Okay, thank you for sharing your experience. So to conclude, if you had to summarize your experience with the evolution of Intimate in one message for the audience today, so what would it be?
So, as I told you, practice and intimate both evolve together. So, it's been a
Mhm.
very interesting and satisfying journey. I would say embrace the radio frequency because it's a color blind technology. So, it doesn't stop you from using different parameters, even in a skin of a color. And that's something which is very good for our community to look at because we sometimes have, darker skin types. So, embrace the different modalities. You'll definitely get good results.
Thank you.
Mine will be to use combinations to bring out the best in best result for the patient. So always combine different modalities. Think about the depth, think about the energy, where you are going to deliver the energy, and use devices which will give multi-layered improvement to the patient. So if you are thinking about acne scar, use MNR for the deeper one, fraction CO2 or FSR for the surface correction. As I said, already we had discussed that. So this is combining different modalities gives the best result for the patient.
Thank you. Thank you, Dr.
Thank
Abhay. Thank
you.
you, Dr. David, for the insightful discussion, for sharing your valuable experience and all the inputs. So thank you everyone for joining us today. We now are moving to the Q&A section. We'll have a few minutes to answer your questions. So doctors, we already have some. I will read you and feel free to share your input. So the first one is, how do you mitigate, if possible, the unwanted adverse skin reaction when using the intensive or the FSR?
So I think we largely discuss it again, depending upon the skin type, depending upon the current skin therapy which the patient is undertaking, we
Mhm.
decide whether we are conservative or we are little aggressive on the approach. So if you are conservative on such patients where you expect the chance of say PIH or a reaction or a downtime of 3 4 days, then you reduce the parameters, you reduce the lesser energy, you reduce it for a like reduce the pulse duration, and probably don't go as deep with intensive, so your downtime is reduced and healing is faster. You can combine the post care little better, so you would probably add maybe while doing a treatment you can add PRP sessions together, microneedling with PRP, so that healing is faster and results overall a little better, and which I presented at IMCAS last year if you remember.
Yeah.
So we combine some patients MNRF with PRP, so the downtime is reduced, results are better even from the first session onwards. And the third thing what you can do is the healing or anti-inflammatory or healing conducive topicals you can add after the treatment is done, which patient uses for 2 3 days, which 2 3 days is a post procedure care, a good use of sunscreen, a very good moisturizer. If you add all these, then you would not get those untoward or unwanted complications.
One thing I want to add is pre-procedure also you can start lightening agents and sunscreen. So the chance of PIH is much less. Pigmented skin will, tan skin will pigment more. So if you start using a lightening cream prior to your procedure and a good sunscreen, that will give a much better, so prevent the pigmentation. The other one we already mentioned, I was applying hyaluronic acid and doing FSR. A moisture on the skin surface can cause arcing between the tips. So that can cause PIH. So always think about it. Dry skin for MNRF is good because it will not create an arcing on the skin surface. So PIH will be much less if the moisture on the skin surface is less.
Yeah, agree. So, Dr. David, you discussed the treating of burn scars or hypertrophic scars. So our next question is, do you combine 5-FU topical when treating traumatic or surgical scars? And like, what's the protocol for this combination?
I have combined ILS and 5FU with in a hypertrophic scar and a traumatic scar, but mostly I'm using intralesional steroids. 5FU I have combined when you want to be more like the scar is very thick and the recurrence is much faster. I have combined with 5FU, but usually it is all intralesional steroids with MNRF.
The next question is about alopecia or regrowth. So do you have any experience or like protocol to share with the audience?
Frankly, I don't use this for hair growth as such. With a lot of other treatments available, I think currently we are not exploring this for hair.
Yeah. Yeah, we actually do this a lot in, now we are having a study with a doctor in Brazil, from Brazil, Dr. Renata. She's using the intensive for like opening the microchannels. And after the intensive, she's putting medications like the minoxidil. She's using also exosomes and she's having very, very nice results. She's doing the sandwich approach, like doing one intensive pass, then putting the medication, and then doing another intensive pass. And we're going to share the study very soon, but the results till now, it's very promising, and like you can see even the result after only one procedure, so it's very nice. And also it's a very fast protocol, because you can do the treatment every 2 weeks, because we're using a very low power, so the downtime is very, very short.
Okay.
So the next question is about hyperdrosis. So I remember, Dr. David, you said that you already have a little bit of experience about this. So if you can share with us.
Dr. Abhay said I haven't done much. It's basically, I wanted to explore how it works. So I had, I think 5 or 6 patients. That's it. But I kept it around 3 millimeter, 3 millimeter and 2 millimeter, 1.5, 2 millimeter to target all the sebaceous and sweat glands in the axilla. It is painful procedure, so you have good local anesthesia or you give tumescent anesthesia when you are doing the procedure. Otherwise, patient is going to like cry out loud in your clinic. So you have to give very good anesthesia before doing the procedure. I have done this. I have done for hidradenitis suppurativa also MNRF, which has given very good results. So basically, you're targeting the sweat glands or the axilla in both the indications, and it has given very good results.
Yeah. Well, thank you. Okay, so we still have questions in the QA section. Can you see it? So they're asking about if you have any experience with hidradenitis suppurativa. Not sure I'm pronouncing it right.
And that is what I said just now. So
Yeah.
One advantage here is even in an active hidradenitis suppurativa, it is bringing down the inflammation. It is bringing action part of it. it is improving the scar, and it is actually tackling the sweat gland. So all these all pathology which is there in hidradenitis suppurativa is with the MNRF. But again, it is very painful because in an active disease, when you're doing MNRF, it is really painful, and you have to give send anesthesia when you're doing the procedure.
Yeah, exactly. I remember like a lot of doctors are doing this, but they are injecting the numbing medication, like the lidocaine. They're not putting it topically, but the results are good, and they're actually like it lasts for like half a year, even more if you like maintain. So
the scarring also goes off. So it
yeah.
is actually tackling all aspects of hidradenitis suppurativa.
Yeah. We have a nice question about the stretch marks. What would you choose? The intensive or like intensive or maybe intensive with FSR or fractional CO2?
Intensive with FSR.
Intensive, because that can go down to 3 millimeter or 5 millimeter for that matter. But as a CO2, it is not that effective as an MNR for a stretch mark.
Yeah, because of the depth. And actually, I think it's also the intensive or maybe the radio frequency in general is more suitable for darker skin types, and you have like less, let's say, less pain, less trauma to the skin, less downtime. Okay. So we have got to the end of this webinar. Thank you, doctors, again. Thank you for joining. Thank you for collaborating. As always, it's a big pleasure and joy to join you in our events. And thanks to all of the participants that have been with us.
Thank you very much.
Thank you. As always, we will send everyone the recording of the webinar, and we will share soon the details about our next one. So thank you. Have a good evening. Bye-bye.
Thank you very much. Bye-bye.
Thank you. Thank you, everybody.